concerns are raised here, including that very last one. And there's that element of integration that people are talking about, or the lady and gentleman are talking about. Just how well engraved in policy is it, such that then it would come in to address this concern of stigma, address this gap that exists in the communication chain?
Okay, so maybe I'll address her question about in engagement with young people. So at the council, we have what we call the Maisha Youth. I've had some of them saying they are part of it. And we have 47 chapters across the country. It would be good that perhaps she gets engaged with the Maisha Youth chapters. And then we also have the county coordinating mechanisms where we have the CHMT, that's the County Health Management Team, and there are young people, Maisha Youth, who are part of that group. Regarding integration, I know that across the country, counties are doing integration their own way. And I've heard him say about Nakuru. So what the plan is through NASCOP is to check what models are counties experimenting with. Because integration means very many things. Maybe between Dr. Samuel and myself and Shamsa, we see integration in different perspectives. Some people see it in terms of locating of services together. Other people, it's about systems, maybe your data information systems, you need to integrate them together. So for different people, it means different things. And we also are aware that counties were integrating based on services. Therefore, it increased workloads. So the plan is to see which model works best for where. Yeah. Once we determine which model works best for where, is it cost effective, then we will do a guidance, a policy guidance. So there is a plan to develop a blueprint for the whole country.
Is this being communicated to the affected, to the...
So there was a summit last year that was delivered through NASCOP to just have a conversation about integration well before this happened. Okay, and there are continuous webinars in terms of what counties are trying to do. So I think there's just maybe what we need to do is talk about it a little bit more.
Some more.
Because I know it's creating a bit of anxiety, especially for the recipient who's receiving that service.
Okay.
Regarding funding, as Dr. Samuel was saying, last week we met with governors, members of parliament for the health committee and the budget. Cabinet is apprised of this matter. They are aware of what is happening. Through the policy budget statement and the current supplementary 2, we have requested as Ministry of Health, as a council, to get more allocation to buy medicines, to also have an emergency kit where we are able to, at the short term, pay these healthcare workers. As Dr. Samuel is saying, majority of the money from the US government was to pay healthcare workers. And that is the reality of what we call a vertical program. When HIV started in the 80s, there was a design. What we are hearing today is what that design was. People to support somebody. So now we have to ask ourselves, going forward, what would be the minimum requirement to support that person? Because that we cannot continue with that model, because if the USG has pulled out, the other day I had an adherence counselor come and see me, telling me he doesn't have work. And it's because of what has happened. So what is the model that we adopt as a country? People are doing different things across the world. South Africa, for example, they are buying their first-line treatment as a country. So what will we do as Kenya? So for me, I think the next couple of months are very determinant for the country, because then we'll be able to set in place what service delivery models we want. Can we afford them? We have to live within our means. Yeah.
We have testing kits?
Yes, we do. In fact, so let me read for you. Condom kit. World Safari Rally. We are there with Nakuru County.
That is Nakuru County.
That's what the same model we used last year.
Yes.
to engage with the World Safari Rally is the same model we'll use for this year. I'm aware that initially, even before the disruption of services, there was an initial delivery of 9 million pieces of condoms, and then another 1.6 that was done the other day. There's an expedited delivery of 121 million pieces. But you know what fascinates me about this country? I was driving, when we were coming here, there are big billboards of alcohol, whiskies, very expensive. So these condoms that we have are for high risk, and the doctors here will tell you, the ones that we provide for free. What we're trying to do as a council is to do a total market approach where people are able to buy. We've even done a study in this country. People are willing to buy a condom. If you can buy a bottle of whiskey, which is 15,000, why can't you buy a condom?
Interesting. I'll be coming back to you, ladies and